Graveyard Smash performers. This is going to be fun, folks. Nothing better in the fall than Holiday World. Avante Skin Center of Louisville. We've got Ashley and Jamie here, and they're going to tell you how you can look your best for the holidays. And Dr. Eli Karam is in the house, one of my favorite guests because he is a licensed marriage and family therapist. We all have relationship issues. This man is the guy to go to. He can tell you how you can get the answers that you need. And real quickly, Doc, before we go, we do receive emails, questions via email. And I want you, if you would, please, to give them the email address if they have any questions they'd like us to address on the air.
Yeah, you want to go to kamft@twc.com, and we're going to take that content and develop themes like we did today. We have an email that came from an actual viewer, and let's tackle it.
All right, I'm going to put you to work. Although my marriage is very strong, we have recently hit a low point after trying unsuccessfully for the past 18 months to get pregnant. We have consulted specialists who have determined that we have combined factor infertility. In addition to dealing with our own shame, we are overwhelmed with assisted reproductive options and the hefty price tag that comes with them. I want to proceed in this direction, but my husband has much hesitation. I hate feeling him shut down just when I need him the most. I never thought we would ever need couples therapy in the past, but now I need someone to help guide us through this difficult time. Do MFTs work with fertility problems? Sarah. Wow, this one is a sensitive issue, and Doc, I'm going to let you have at it.
All right, let's tackle that. First, let's do some basic education around infertility. So infertility is defined if you've been trying to have a baby reproduce for a year unsuccessfully. So, and you get a diagnosis like that, it could be for a number of factors. It could be a pre-existing problem, but most people enter into a marriage thinking that they can have as many children as they want unless they know something different. So for a lot of couples to get this news, it hits them like a ton of bricks. So you can have what we call male factor, where it's the male's issue, or female factor, or sometimes, like in this email from Sarah, combined factor, where it's a combination of the man and the woman causing the infertility, or sometimes it's just unexplained, and that accounts for about 10 to 15% unexplained infertility. So can marriage and family therapists help? Of course they can, but let's talk about first, sometimes when you're in the bubble of your head in your relationship and you've never had any problems, and this, like I said, hits you like a ton of bricks. So common emotions and common things that you might be going through. So you could be struggling with infertility, you could be experiencing really a roller coaster of emotions, sadness, guilt, and anger, and this idea that you feel that other people can go and get pregnant, and why can't you? And it feels unfair, and it's not how you planned it. So it's an intense experience, and not just for the woman. It is fertility is a couple issue. Even if the problem resides in the female factor, it is a couple issue. So just don't assume that if you're a female viewer out there, you're the only one going through this. Your partner is going to have similar reactions. You can also feel very, again, lonely, and not only not being able to talk to other people because of the shame and stigma that many people have if they cannot produce children biologically, but also that you feel like you can't talk to your partner about it, which leads so general, how to proceed, as in the email, as far as assisted reproductive technology, which can be very pricey, as most insurances will not cover that. Some in vitro fertilization rounds of treatment range up to $20,000 or more per round. So you might have financial pressures to go along with that. You might be fighting with your spouse, and even if your spouse is on board, this idea of, do we have the money to invest? And for many people, it is multiple rounds of doing this. So it's not like a one-time guaranteed thing, and you have a consultation with doctors and medical specialists, and they're trained, you know, to give you the knowledge, but sometimes they don't have the bedside manner, if you will, to kind of work with you on the emotions, and that's what an MFT could do. So the other thing you could experience of that is just really confusion and feeling like everything is not working right for you, and that's when you need to talk to a marriage and family therapist. Difficulty concentrating. It seems like it's hard to go on, not only with your work life, with your social life, and another indicator we always see is really this idea of social isolation. It's hard to go, many women will experience hard to be excited for their friends that are getting pregnant, to go to baby showers, to go to anything associated with anybody having a child. It makes it very difficult. So a lot of people withdraw, both from other people and from their partner. So you have two people that really, it sounds like in this email, that love each other but are really having a hard time, really for the first time in their marriage. So what can marriage and family therapists do? Marriage and family therapists can work with you, and many times you've already had the consultation, you already have the medical opinion on what to do. Marriage and family therapists are going to help you and your partner work together to talk about not only how to proceed with the various options. Many couples, as I said, want to proceed, but they do not have the financial resources. Or in this email, one partner really wants to, and the other partner is ambivalent. And this is not something you can do without your partner's full support. It won't work if one person wants it. So it is a dialogue, it is processing. So a marriage and family therapist is going to help you talk about both the emotions and all the logistical things that go along around trying to get pregnant. You know, John, many times in this situation, people will have to alter their work schedule. They will have to take time off, put time aside. When you're going through a round of this, it takes a lot as far as a certain shot at a certain time, a certain doctor's appointment. So it takes a real team effort. So many people, you know, suffer in silence with this, but you can go and get help, and you can get a lot of support and normalize a lot of these feelings that I've mentioned by going to a marriage and family therapist.
You know, Dr. Eli, I know this is a very serious, sad, and sensitive issue, but there was something that really stuck out like a red flag there for me in her letter, in her email, when she says the word shame. And to me, it's like, it's something you're born with. It's like having freckles. I'm ashamed. I'm ashamed. I don't think there should be a shame factor involved. As you and I were discussing before we went on camera, you said this happens fairly often.
Yeah,
correct?
About 8% of the population will experience this. And obviously, the older you get, your fertility decreases. That magic number for women is around 35. You see a marked decrease in fertility. So this idea that people carry shame because, as I said earlier, most people believe that, okay, I can have children as many as I want, when I want, and it doesn't always work that way. So this idea, even though we know there's many means, and as we talked about on the show a couple of weeks ago, I had a colleague, Laura Wagner, in, many people that do not want to go with the assisted reproductive technology, in vitro fertilization, or artificial insemination, or some other technologies, they go the adoption route. But there is a shame kind of associated in our culture when you cannot have children. And what a therapist will do will help normalize that, and also help you get support from your partner, because there's also a lot of blaming. It's one thing if it's combined infertility, but if it resides with one partner, there's guilt and shame that one partner. You know, maybe you should be with somebody else. Maybe this isn't right. And a lot of people will take their frustration not only out on their partner, but out on themselves, which is, you know, very damaging for a relationship.
Dr. Eli, I know this is just another issue that licensed marriage and family therapists can help with. Any relationship issue, correct? Because I think sometimes we think it's all about couples and, you know, we're having an argument about this or that, but we talked about peripheral family, friends, co-workers, etc. Any relationship you may have, correct?
Yeah, marriage and family therapists work from a relational point of view. They are trained to see strength and health, so they're not going to view you as the problem, and they're going to help you whether you're in a relationship or not. Many people come either when they've exited a relationship or they're determining why don't relationships work for me, and they've seen this pattern. So you don't have to be partnered or in a family to see a marriage and family therapist. And remember, there's about 400 of them in Kentuckiana, and many of them located in Wave Country. And again, I'm a representative of the Kentucky Association of Marriage and Family Therapy. So if you want to find one of these marriage and family therapists that can help you if you're struggling with infertility or any other of these issues we mention on the show every Thursday, you can go to www.therapistlocator.net, and that is going to be our national clearinghouse, the American Association of Marriage and Family Therapies, way to locate any therapist. So you click on that rectangular red box that says locate a therapist. You might already know the person you want to work with, but if you don't, you just want to enter in your zip code, and what that will do is will give you a list of therapists in the area. Many of these therapists will have their profile fully there, and many of them have their own website. So you click that on, you find a therapist that's a good fit for you. If you are struggling with these issues, many therapists are going to list on there that they work with fertility or adoption issues, and what you want to do then is call, and they'll give you a consultation, and you'll decide if it's right for you and your partner to go in and see them.
All right, Dr. Eli will be back next Thursday. Coming up here, we're going to have you holiday ready, looking good, young for the holidays. Get ready, because Avante Skin Center is with us. We'll be right back on Wave 3 Listens.